Welcome everybody. We are now live on Facebook. Welcome everybody on Facebook. Welcome to everyone who's joining us today on Zoom. My name is Judy Mark, and I am the president of Disability Voices United. I am also the parent of a young man who just turned 24 on Saturday, and we had a lovely little birthday party for him with just our immediate household. So welcome everybody. This is our second town hall in a week, and we know how important this is to all of you to get people with disabilities the vaccine. And so, you know, we have a set of speakers who are really extraordinary. I'm sorry, I'm looking down because I just want to do a Facebook live share. So I'm doing that and we're done. So we know how important this is to you, and we hear you and we hear your concerns. And so we are doing everything we can to advocate. All of the people you're going to see today are people who are advocating to ensure that people with disabilities who are at high risk of hospitalization or death are going to get the vaccine. And so what we're going to do today is we're going to start with Andy Imparato, who's the executive director of, before I go, I so apologize. I need to make sure that those of you who need Spanish interpretation know what to do. So strike the introduction, and we're going to go first to either Lorna or Annabella. If you could say in Spanish how our Spanish speakers can get access to the simultaneous interpretation. Lorna, Lorna, are you able to do that? I know you mean.
Can you hear me? I am speaking in the English line.
Yes, go ahead.
Para las personas que hablan español, para acceder a interpretación, deben hacerlo. Si van a la parte de abajo de su pantalla, si están en la computadora, van a ver la función de interpretación. Es un mundito. Si hacen clic en el mundito, ahí pueden elegir el idioma, eligen español. Es mejor si ustedes silencian el audio original. Ahora, si están en teléfono, no van a ver el mundito, van a hacer los 3 puntos que están en la parte de arriba de su pantalla, y si hacen clic en esos 3 puntos, ahí tienen la opción de unirse al audio y de ahí acceden a interpretación. Gracias. Thank you.
Gracias. So some of you may not have been hearing what that, you're just hearing silence. And that's because the interpretation was on the English line. So for those English speakers, please go down to the bottom of your screen under interpretation, and please choose English as your language or Spanish as your language. Great. And then I should also mention that you can get closed captioning as well. By going to, you'll see in the chat how you can get closed captioning as well by going on the more button. It kind of depends on where you are on your screen. Okay, so let's get started again. I want to welcome everybody one more time. We have amazing speakers today, and we're going to start with where things are. What is the lay of the land for getting the vaccine to people who are high risk with disabilities. And so I've asked Andy Imparato, who's the executive director of Disability Rights California, who is also a member of the California Vaccine Advisory Committee, to sort of tell us, there's a lot happened this week, but we don't know whether we're any farther along in getting the vaccine. So please give us an update and tell us what else we can do.
Thank you, Judy. Can you hear me okay?
I sure can.
So again, I'm Andy Imparato, and I'm the Executive Director of Disability Rights California, and I'm grateful that Elizabeth Gomez, who's on my board of directors, is going to be speaking with you later. And I see we have other DRC staff in attendance. So after I have to leave, there are going to be other DRC folks here if questions come up that they can help to answer. You know, here's the headline from my perspective of this week, and I very much value and respect Judy's perspective. So I've asked her to chime in when I'm done if there's anything that she wants to add. But the headline for me is that our advocacy is working, but we're not there yet. And what I mean by that is the governor is noticing that California is not happy with the idea that people who are at risk of dying from COVID are going to have to wait until June because they're under 65. Like, that message is not resonating. It's not resonating with the press, and it's certainly not resonating with people under 65 who are at risk of dying. And I know there are a lot of folks in that category on this Zoom call today. So what happened yesterday, the Community Vaccine Advisory Committee met, and the drafting guidelines work group, which are the people that are making these decisions about who to prioritize and why, they let us know for the first time that based on data that they saw that said there are some people with disabilities who are more likely to die from COVID, they're recommending to the governor that the next group for prioritization after the 65-year-olds and after the essential workers should be people with high-risk disabilities. So on the one hand, that's good news that they're saying that we're a priority, but the after part is potentially a problem. We don't know what that means. It could mean two things. The best case scenario is that they will do people with intellectual and developmental disabilities who are getting services from regional centers and other high-risk individuals once they figure out how to do it. And that could be as soon as next week. That's the best case scenario. The worst case scenario is they will do 11 million people in California, everybody over 65 and all of the essential workers. And then when all of those people have access to the vaccine, then they will get to people who are at high risk of dying who are under 65. That is unacceptable. If that is what they meant, we need to make it clear to the governor. Again, the governor is the decision maker here. We need to make it clear to the governor that that is unacceptable. We will not wait until June. We cannot wait until June. If we are forced to wait until June, hundreds and hundreds of people across the state will die unnecessarily, and it will be the responsibility of the governor. So in terms of what can we do, what should we do, focus our advocacy on the governor and get our elected officials, our state legislative officials and our federal representatives to contact the governor and say, you need to prioritize people with disabilities and you need to prioritize them now. You need to commit to a time frame to vaccinate people with disabilities. If you need 2 weeks to figure this out, then commit that it'll happen in 2 weeks. But it's not acceptable to say, you're next, because we don't know what that means. And next could mean in June, which is unacceptable. So that's the situation that we're in. The presentation last night was very confusing. And because it was confusing, we had two different headlines the next morning. One paper said people with disabilities have won their battle and they're going to get vaccinated. The other paper said people with disabilities have to take a number. And both interpretations could be correct, because this is just a recommendation to the governor after all, and there's no guarantee that the governor is going to accept the recommendation. So again, we need to tell the governor himself what he needs to do in order to protect the lives of people with disabilities. And I think it's worth reminding the governor that he was one of the first in the country to shut down California because he wanted to protect the lives of elderly people and people who were immunocompromised. And that's what we're asking him to do now. Give the vaccines to people who are immunocompromised at the same time that you're giving it to people who are elderly. Why make the immunocompromised wait? If you make us wait, people are going to die. So that's the message. The message is to the governor. The media is on our side. We're getting lots and lots of media attention. Judy is doing a great job. A lot of folks, Alice Wong, others are doing a great job. We need to keep the pressure on the governor. They've created a task force to work with them to come up with a plan to deploy vaccines. That task force is meeting for the first time tomorrow at 4. We'll have more information after that meeting, but what we're going to be pushing for in that meeting is a commitment to vaccinate people by a certain date. We don't want to leave this open-ended. We want to know that by March 1st or whatever date they can live with, as long as it's not June, that people will start getting vaccinated, and that will create some urgency for us to plan. How are we going to get the vaccines to all the regional center clients? How are we going to get the vaccines to people who get in-home supportive services? And all of this is doable, but the state needs to decide that it's important. And right now, we don't know how important we are. It's very unclear, which is why we have to keep advocating. So I'm going to stop there and see if Judy wants to add anything.
I do. For those of you who don't know, this California Vaccine Advisory Committee that Andy sits on is public. It's not a closed, secretive process. They actually show it on YouTube, and I watched it yesterday. And this is what I interpreted happened. I actually was very frustrated late at night last night, and I wrote it on a Facebook post. This is what I heard that they said. This is the Department of Public Health. This is what I heard them say. We are considering maybe at some point in the near or distant future that we might be thinking about giving the vaccine to a subset of a portion of people with disabilities who can prove that they are really seriously and not lying about being super duper disabled. And that people with developmental disabilities are not at that much risk if you don't live in a nursing home, because our data shows that only a few of you are dying. And we don't care that many of you don't report it to your regional centers, or that you are not dying as much because you haven't left your freaking house since March, and because you are not valid human beings anyway. So it's okay if you stay in your house until your priority age comes up, which may be sometime at the end of the year or never. So that was pretty much what I heard them say yesterday. It was, showing data that people with developmental disabilities are not dying, are dying way less than even the general population, and trying to lay out their case for keeping that community out. And secondly, they were saying, we're going to do this. We just don't know when. It'll happen at some point. We're just not sure, and kind of dragging us along. So Andy, is that what you heard?
I think everything you just said is a fair interpretation of what we heard last night. What I would add is they also said that when they start deploying the vaccine to our community, they want us to go to hospitals and special locations, but they don't want us to go to the generic sites where other people are getting the vaccine. That's actually illegal. To say that disabled people need to go here and everybody else can go to Dodger Stadium is illegal. Now, there's nothing wrong with giving us extra sites, but we all should have access to Dodger Stadium if that's where we want to get the vaccine. So I think they were grasping at straws. They don't understand our community. They don't understand how to do this in a simple way, but they are creating a task force to figure it out, and that task force is meeting tomorrow. But your summary is fair, Judy. It was very frustrating for a lot of us. And this whole data issue is particularly frustrating because it's not our fault that we don't have good data. The people that study health equity do not study what happens to people with disabilities in a pandemic. People are not spending money to study us. They're not identifying us as a denominator. The person from Blue Cross Blue Shield said, we're going to ask about demographic information when we vaccinate people so we can do an equity analysis. Guess what they're not asking about? Whether people have disabilities or chronic health conditions. So we have an uphill battle, but I go back to my first message, Judy, notwithstanding all of that, we are having an impact. They are paying attention to us. They've created a task force. There's 2 cabinet secretaries meeting with us. They're doing that because of the pressure that Judy and other people on this call are putting on the governor, and we need to keep it up.
Wonderful. So the other thing, we have a number of questions, but the one thing that I wanted to do is to just share screen rather quickly. And do people see this PowerPoint that I should probably press play on? Play from start. Do people see that?
Yes.
Great. Okay, so if you want to know who to contact, why don't you go through this, Andy, to make sure people understand, and whether it's just the governor or whether we should do all 3 of these folks that we've been targeting.
I mean, I think the phone number is good because they keep track of how many calls that they've gotten on issues. I think the email is good because they keep track of emails. The phone number, for people that can't see this, is 916-445-2841. And the email is govapps, govapps.gov.ca.gov/gov40mail. That's one of many email addresses for Governor Newsom. But the other thing that I would suggest is just send him a tweet. You can call him out on Twitter. He actually pays attention to Twitter. He's Gavin Newsom on Twitter. He's also CA Governor on Twitter. So don't forget that Twitter is a simple way to get to him if you can't remember a phone number or an email address. The phone and email is good though, because they do keep track of volume. So if we can generate a lot of volume, that helps. And then for Secretary Ghali, who's the Secretary of Health and Human Services, who I see as an ally to us. I think he is trying to make us a priority, and he's spending a lot of personal time on this, which I appreciate. His email is mark.ghali, spelled Ghaly, at CHHS for California Department of Health and Human Services .ca.gov. And he does read those emails. He gets those emails personally. And then the head of the California Department of Public Health is Dr. Tomas Aragon. There's no R on it. It's just Aragon. Yep. And the email is tomas.aragon, Aragon, at CDPH for California Department of Public Health.ca.gov. And that's the chain of command. The Department of Public Health makes a recommendation to the secretary, who makes a recommendation to the governor. But this decision is the governor's decision.
Right. Okay, so then the other piece is looking at the, we have in Spanish, and we'll get that posted, everybody. Then we have.
And Judy, just real quick, Rachel Douglas pointed out, and I think it's a good point, the hashtag #HighRiskCA is where a lot of people are telling their stories on Twitter. So if you do tweet, go ahead and tag that hashtag #HighRiskCA. And Rachel's also saying vaccinate now is another hashtag that people are using.
Great. So and here's some messages. We'll be able to get this to everybody, introducing yourself, explaining why the vaccine is important for you or for your family member or your clients or whoever it is that you care about. And it doesn't have to be long. Just get it done. Get it done today if you can. And if you've already done it, do it again. It's important to do it multiple times.
And I've been just going on there and retweeting what other people have tweeted under #HighRiskCA just to try to amplify, because there's a lot of really compelling content that's already up there.
Yeah, absolutely. Thank you, Andy. So let's go to some of the questions that folks have. Jordan, you are first. I'm going to let you unmute yourself.
Thank you very much. But my question, if anybody wants to answer it, and especially to the gentleman from last week, I don't see him right now, but he spoke about getting people in, whether you're in a group home or a living care facility or retirement home, getting somebody out to give the shot. My concern isn't so much that we're not giving vaccines to disabled people, is being able to pick the vaccine that you want. I know a lot of people that don't like needles and don't want to do a booster shot. So they're looking for the J&J, the Johnson & Johnson to come out. Is there a way through these letters we can request the vaccine we want when the Johnson & Johnson come out? And I know they're taking a long time. Or if we ever get, should we be able to get that vaccine? That's a one shot. Maybe they'll test it on a booster shot. They are testing it for a booster shot. But for now, should that get approved in the next week or two, that would be a one shot. And that would be certainly a lot easier for us in the disabled community to get. If they have to come out and give it to us, you don't have to make an appointment for a second round in 3 weeks or 21 or 20 days. So
Jordan,
my thing isn't so much getting the shot today and getting him approving and say, okay, you guys can go out and get a shot tomorrow here and get a letter from Renal Center. My concern is I want that J&J shot when it comes out. I want to be first in line and get one shot and be done with it, at least until they figure out when we need the next one, whether it's a year or 2 years.
Yeah, Jordan, you make a good point. The Johnson & Johnson vaccine has not been approved for use yet, but once it's approved, we've been arguing to the state that we should be a priority population for that vaccine for multiple reasons. One is what you're saying, one shot is easier for a lot of folks with disabilities, but also that vaccine doesn't have to be refrigerated at the minus 96 degrees refrigeration. So it's much easier to take it in a mobile clinic and take it to people where they are. So we can have that vaccine deployed across the state with people going around in vans and trucks and deploying the vaccine on the ground where people are. So there are a lot of people who might not be able to get to some of the central locations where the vaccines are being deployed. So we have been making that case to the state. The state doesn't know when that vaccine is going to be available, but the state could commit that we are a priority population when it becomes available. We'll still advocate that people have access to the ones that are available now, but you're right. Once Johnson & Johnson is out there, that's going to be a good opportunity for us.
Thank you, Jordan. Great question. Next is Sandra Donna. Hi, Sandra. Oh, hold on. I got to let you unmute. Go ahead.
Hi, Judy. Good to see all of you. I do have a question regarding the data. I know that you were wonderful and had a number of these webinars beginning from the early days of the pandemic. And at that point in time, you had a wonderful presentation from Special Olympics and the physician there that is the head of their medical services. And at that point, the only data that we had on people with developmental and intellectual disabilities was coming out of New York, and it was being studied very carefully by Special Olympics. So we do have some data on how this is disproportionately affecting our community. Can you talk about why that data hasn't been used, or why it is, and this really goes to Andy, why it is that folks on that committee that you are on aren't really familiar with that data and that information? Because I feel like the data about our community is out there. You have to dig for it, but it's out there.
Yeah, thank you for that question. I didn't mention, but there's a wonderful physician at Stanford named Melissa Burghardt who got 400 physicians to sign a letter in 2 days saying that we have plenty of data to tell us that we need to prioritize people with disabilities. We need to prioritize regional center clients and IHSS recipients. This is not rocket science. The science supports that. And she cited all of the best data, including the Syracuse study that you're referencing. The folks that are on the drafting guidelines committee for the California Department of Public Health want better data. I mean, what Judy said is exactly right. They're saying that our data is not good enough, that there's not enough of it, and the risk is only bad if you're in a congregate setting. So all these people that are at home that have a civil right to live at home as people with disabilities are not dying fast enough, so they don't deserve the vaccine. I mean, it's ridiculous. It's not tenable. I think the state's position is going to change, but it's going to change. I firmly believe this. It will only change if we keep the pressure on the governor. We cannot let up. We need to keep the pressure on the governor until the governor commits that we will all have access to the vaccine by a date certain, and that has not happened.
Thanks, Andy. So I'm going to just take a couple more questions, but I want to make sure that your questions are for Andy, because we're going to have time. We're having a lot more experts where we're talking about the safety of the vaccine, how effective the vaccine is, and how to access it, the equity issues. So this is really sort of more of a question about what the state is deciding around this. So I just want to make sure those are the questions we're going to ask. So Lourdes Gomez, you're next.
Okay, so I am totally livid. I went yesterday to get the second vaccine. I went and I was told that there is a second line for people that do not have appointments and are actually people younger than 55. So I am totally like frustrated. I took pictures.
So Lourdes, I'm going to stop you because I want to make sure that the question is directly related to the issues that Andy presented, which is people with disabilities getting the right to have the option to get the vaccine. Is that what your question is about?
So if that is happening, and it is currently happening, it was yesterday, what are you guys doing to control that? Because I love what you're bringing, the information, how you're being honest, but can you bring this very important point to the people that are doing this? Because I cannot be comfortable when that is happening in South LA, I have to be honest, it is something that bothers me tremendously as a parent of a child with special needs.
So
We need to
Lourdes,
address that too.
did you get the vaccine yesterday?
I made an appointment. My second vaccine, I got it. My
Okay,
issue is that it was AmeriCorps. It was programs that are before the teachers, young kids, 20, 25, 30, and there are people on a second line making for in the afternoon without an appointment who were younger than
yeah, you're
35.
saying that it's not fair that they're giving it to other people who are under 65 and even under 35, and they're not giving it to people with disabilities. Is that your point?
Yes, so
Yeah.
that's a very important, relevant point.
Yeah.
Can you
So-
address that with the powers
Yeah,
to
let me just say that the way California has been deploying the vaccine so far is that the counties have had a lot of discretion. So it's kind of the Wild West. Some counties are giving the vaccine to anybody who shows up in a car, they do the whole car. Some counties are being a lot more careful about who gets the vaccine. The state is trying to create more central control. They got Blue Shield to take over the deployment. But right now, there are people with disabilities who are getting the vaccine at the county level, even though we're not in their priority tier, because they just show up and get it. So I think one of the lessons there is, yes, we need to do the advocacy with the governor, and that's important. But we also should be doing advocacy at the county level to say, prioritize people with disabilities to keep us alive, and don't prioritize healthy people who are under 65 ahead of us, which sounds like that's what happened in your line yesterday.
Great, thank you. Okay, one more question is going to come from Zoe Giesberg. Hey, Zoe. Oh, whoops. I got to find you, Zoe, to unmute you. Where are you? Oh, you're gone. Oh, let me look for you, Zoe. Sorry, Zoe.
I think I've seen Zoe. There she is. I see her on the top.
Okay, there you are. Got you.
Sorry. Hi.
Okay.
I think, I've been tracking this for a really long time. Ever since it was out, I've been with clients who have had that. It seemed one of the things that we have discussed is that there is a general lack of transparency in everything that the governor has done, from the rollout to the reopening of California. And I was wondering what your efforts were to get them to be more transparent, because it feels really shady, this whole thing that's going on. And I think, as other people have mentioned, there have been tons of people at various counties who have been able to manipulate the system to jump ahead in line than the people who really need it. I'm lucky that I happen to fall under the general spectrum of a healthcare provider. So I was able to get the first Moderna shot at Dodger Stadium a couple of weeks ago. Otherwise, I would be completely screwed as an autistic person. And that has been something that I have been telling them, the fact that I had a different qualification to get me there should not be the thing that had gotten me there. And I can't tell my clients that I got it, because I know they would be angry. And I feel like something fishy is going on, and I think the governor needs to be called out on it very publicly.
Zoe, let me say, it's interesting.
So, yeah.
I don't disagree with you, and I think I've seen you on Twitter, so thank you. If you're Zoe G on Twitter, thank
Yes,
you for
I am.
all. Thank you for all your advocacy. But the governor and all of the state officials have said to us repeatedly that they have 3 goals: safety, equity, and transparency. They've said that repeatedly. What they haven't done is delivered on those 3 goals. You know what the number 1 goal is right now? Efficiency.
Safety.
The reason that they're
efficiency.
giving it to people over 65 is because it's efficient. They could do a bunch of people. It's easy to identify somebody who's over 65 unless they have a fake ID. So they think that that's efficient, and they're throwing all the other goals out the window. So we need to get them to slow down and remember that transparency is important, which means you need to actually tell people who's getting the vaccine and why. Equity is important, which means you've got to get to high risk people while you're doing people over 65. So you're exactly right. We need to remind the governor that one of his top goals was transparency, another top goal was equity, and he is failing on both of those goals so far. And
Thank you, by the way, for following me on Twitter. And if you got any positions open, I'm right here.
All right, sounds good. On that note, I'm going to take off to talk to a reporter, but thank you, and thank you for your leadership, Judy.
Take care.
Yeah, bye-bye.
Okay. So we're going to move on to, we have other presenters who can definitely answer a lot of these questions as well. And I will do my best to do that as well, although I don't sit on the statewide advisory committee. So our next speaker is Nikki Brown Booker, who's a program officer at the Borealis Philanthropy, and just started giving out lots of money in relationship to the Disability Inclusion Fund, which we are so honored and thrilled at Disability Voices United to be one of your inaugural grantees. I asked you, Nikki, to think about this from an equity perspective, because I'm very concerned that even if we win this battle, it's just the first battle of a larger fight, because we have to make sure that people who are really disenfranchised, people who maybe don't have access to computers, they don't know how to make appointments, that we really look at equity within the equity framework of disability. So tell us what you're thinking about, Nikki.
Well, thank you so much for inviting me to talk about this. Like you said, I'm particularly excited to be here because you are one of the grantees for the Disability Inclusion Fund, and the work that you're doing is so important, particularly around vaccine equity. So I really thank you for the work that you're doing, and I'm just very excited to support you. So I wanted to just tell a little bit about my own personal story around the vaccine issues, and then I can go a little deeper into the equity. So, I'm a person with a disability. I'm biracial. I'm Black and Filipino, and I have an autoimmune disorder myself. And my mother is 88 years old. She's a Filipino immigrant. She lives in a small town near Sacramento, and she lives in a senior community. I also have a cousin who has breast cancer, and my brother has like congestive heart failure, and they are, except with the exception of my mom, we're all under 65. So, and we're all, my cousin, is like stage 3 breast cancer. So, she really needs to get the vaccine. My brother, has had several issues with his heart, so he really needs to get the vaccine. And we're all people of color, and we all live in areas that have been disproportionately affected by COVID. And the problem, this vaccine rollout is really a problem across California. I live in Northern California, and we are having, a lot of the same issues that you're having in Southern California. My mom, who is currently in the 1B priority group, whatever, she's like, she's the under 75, over 75. We just got her an appointment to get vaccinated tomorrow. And, one of the challenges that we had with getting her appointment is that she's a senior who doesn't know how to use a computer, who lives in kind of a isolated senior community, like many Californians. And it was really up to me and, one of her other caregivers to literally, like, I would spend, the first thing I would do in the morning was go on the Kaiser website to see if she was going to be able to get a vaccine. You know, and then during my lunch break, I'd go on the website for the county that she lived in. And then I would try and sign her up for the county that I lived in. It was just this real like madness around trying to like get someone who's actually in the priority group to get vaccinated because she was a senior, because she has a disability, because she doesn't know how to use a computer, which is, you know, really an equity issue for many people. And then so that was like kind of the issues that I was having, you know, getting my mom vaccinated. Thankfully, she's going to be able to get her first vaccine tomorrow. But you know, there are lots of people, lots of Black and brown people that live in poor neighborhoods that don't have adequate access to healthcare, that have disabilities. Technology and lack of access to technology is a very big issue, particularly around equity, because if you don't have access to a computer or to the internet, or you have to, like, you know, you used to be able to go to the library to get to get on the internet if you needed it, and then that's not something you can do right now. And if you don't have access to a car, and even like going to get COVID tested, a lot of the sites require you to be able to drive up to the site to get tested. A lot of the vaccine sites are drive-up sites, and if you don't have access to a car, then that also puts you at a disadvantage. Another issue up here in Northern California, where some of the vaccine sites are going to be near public transportation sites, but you know, taking public transportation is also puts you at risk, right? So that's also another issue around, you know, of people who are Black and brown being really disadvantaged. And that we're just so low on the priority list. One of my concerns about the governor getting rid of the tier system and prioritizing people based on age is that means that like a 58-year-old white man who works in tech is going to get vaccinated before me, before my brother, before my cousin. And that there's something not quite fair about that, equitable about that. And don't get me wrong, I want him to get vaccinated too. I want him to get vaccinated because we all need to get vaccinated. It's like, it's not that I don't want him to get vaccinated. It's just that I don't think that it's fair that he has the priority over someone who has cancer or, you know, heart issues, or who has an autoimmune disorder, or has a disability, significant disability. So I think those are some of the really, you know, big issues that come up. And like you said, the governor needs to hear from all of us. And, you know, however you need to reach out to him, you need to reach out to him so that he really hears what we need.
Thank you. That was very thoughtful. I hadn't really thought about, you know, of course, people who don't have cars, I thought about that, but then I'm like, oh, right. And then they can't take public transportation either. So it just becomes sort of a logistical nightmare, and we have to put it in people's communities that they can get to easily. Thank you for that, Nikki. Hold tight because we have a couple more speakers and then we're going to take some questions for you. I'd now like to introduce Stephen David Simon, who's the Executive Director for the City of Los Angeles Department on Disability, which is really grappling with all of these accessibility issues directly and these equity issues head on. Thanks for joining us, Stephen.
Sorry, I had to move to turn my lights back on. Hello, everyone. And of course, thank you, Judy, and your team for your extraordinary work. From what we're hearing on our end as well, the state is really close to establishing vaccine eligibility for people with disabilities. A great part of that is because of the calls that have come from this group, everyone that's in this meeting and the prior meetings that you've put on. again, we have to keep that pressure up. I'll expand on both Andy and Nikki's comments, I think, on how vaccine access is operationalized. What are the aspects of the disability community needs to be advocating for in terms of accessibility? Particularly, I do want to emphasize people of color, immigrant communities, non-English speakers, and people without access to technology. That's a gap for so many people in our community and so many people on this call. As Andy noted, we're just not there yet in terms of getting this access, even from the great success I think we had in the meeting yesterday. And then once the state opens broader eligibility for people with disabilities, our advocacy still won't be over. So be super clear on that. First, to keep in mind, once the state opens up eligibility, local health departments need to amend their plans to begin vaccinations for people with disabilities as soon as possible. We saw that even with seniors. It happened in different counties at different times once the state opened the door. So you're going to need to be prepared to contact electeds at the county board of supervisors level if that's who's running your health department. So that's probably a week or two away, but we should be letting them know soon how high a priority this is. And as local cities and counties begin to roll out, here are some key factors I just want to highlight. For all of your advocacy calls, we still need to be short and sweet and focus on full eligibility and full eligibility now, okay? That's the key point. Your personal story needs to be in there, but remember to lead with what our goal is. How we define disability is going to be huge in this. The baseline that was used when we were in, well, we still are, we're in phase 1C, right? Was people who have an underlying health condition or disability which increases their risk of severe COVID-19. I would argue that's everyone involved in this call, right? That's going to be a very big debate. They're going to try and make it as small as possible a group, I think. And again, I need us to argue there are different arguments for different communities that are part of the disability community. And you need to be ready to have the argument fight why you are personally at risk to be severely impacted. I'm a strong proponent of using the model they're using to justify the age-based system, which is susceptibility to COVID as a key factor. But I do want to make a point here that we need to concurrently prioritize addressing the risk of exposure at work for caregivers. I do think caregivers is a high priority because if they don't get access about the same time we do as a community, we're still going to have additional transmission that we really strongly need to avoid. A second key point on definitions is what proof of disability is required, right? We need to minimize the burden on recipients. We need to protect private medical information, make it as easy as possible for us to have access and demonstrate for people with a disability, at the same time trying to prevent fraud. Be cautious on this. I'm very nervous for the fear of preventing fraud. They're going to make a really high burden of proof. And again, that will be something that really devastates our communities and disproportionately impacts, again, particularly people of color and others. I'm trying to actually skip through notes here because I can go on this. I've been adding things after hearing Andy and Nikki talk. The accessibility of the current system. So key factors that are going to continue to matter when we have eligibility. We need to have timely notification of eligibility. The communications need to be fully accessible. This is something that a lot at the state and county and city level is not in place yet, and they should be working on it now. We need to know that the information websites are not only accessible and navigable, but are in multiple languages to really serve the communities that we all serve. Public health departments have that requirement already, and they should be able to make all this information available in multiple languages. And of course, captioning needs to be available on videos and so forth. Look now, go to your public health websites. If you see a gap, let them know about it, not to complain about it, say, let's get this fixed now. The entire physical sites, whether it's large ones like Dodger stadiums or small community-based ones or mobile sites, they need to be ADA compliant. It's so obvious for us to say that, but people don't get it. And I keep hearing a defense, well, we're in an emergency. This is a temporary site. That doesn't matter ever. Okay, the sites need to be ADA compliant. We need to make sure, I've had complaints where people with service animals were not allowed into a vaccine site. We desperately need to have a service animal with them to get, to get the vaccine. Sitting areas, wheelchair accessible waiting areas. If you're gonna be online for 3 hours, maybe that's the way it is, but there has to be accessible space to do so. A place where people can have calm and quiet as well. So easy to set up, it's a pop-up tent. And also there should always be a point person on site to address accommodation requests no matter what they are. There is increased pressure, of course, to get mobile vaccination programs available. We need community sites. Look, where folks can go to the big sites, let's go, let's utilize them, let's make sure they're accessible. But where they can't, again, I've got a call from someone who's a person living with a disability, uses a wheelchair, who's over 65, but she can't get to a vaccine site. It's just not viable. She's eligible already. Those are the kind of things that should be easily fixed. I know in Los Angeles, our fire department is using mobile vehicles. I know our health department at the county level has mobile vehicles. We've talked about deputizing the HIV and AIDS testing system because they have mobile health vehicles. We need to make sure that these vehicles get to our communities because eligibility isn't going to matter if we can't get access to the vaccine directly. Other highlights, of course, accessible transportation, right? The in-between model, right? That's just a given for so many people in our community, as Nikki just mentioned. I sit on the LA County's COVID-19 Vaccine Equity Committee. The committee is transmitting a report to LA County Board of Supervisors soon, hopefully in a matter of days. I think we're doing some final edits this week. It includes a lot of these issues we've talked about, recommendations on accessible and inclusive communication, accessible vaccine registration and sites, partnering with trusted community-based organizations to get information to our communities or to use them as vaccine sites. One thing I think that is missing, and it came up on this call, and I'm glad it did, is the need to compile the data showing the disparate impact of COVID infection, as well as vaccine participation, vaccine system participation for people with disabilities. There's no plan I know now to even count us, to even consider the demographic. And I think it's absolutely vital as we move to the future, and there's other really emergency situations that we have the kind of data we need. They complain we don't give them good enough data, but then people don't count us literally in the system. So I'm hoping that happens. Quick other footnotes. I mentioned this on last week's call. There are a lot of people with disabilities who were already eligible and the caregivers who are in either skilled nursing facilities or any kind of assisted living facility. It's broadly defined. Special needs group facilities, assisted living facilities. I'm having trouble getting data on how many people are getting tested. Are they going out to the facilities to get that same efficiency they're trying to do with facilities that just have seniors? We should be getting thousands and thousands of people vaccinated in that system, and we need that data. We need to know what's happening, and if it's not happening, we need to know the time frame with great specificity. I'll leave it at that for now and answer the rest in questions, and just say that we really look forward to continuing to work with Disability Voices United and the partner organizations here. I'm going to try and follow up with Andy and get on a call soon to see how we can all work together. But make those phone calls. It is working. They are listening. We know for a fact the changes in process. But once that comes out, we can get excited. We can thank people that helped. But then we need to say, here's the next step. Where are the details? And make sure they're truly accessible and inclusive.
That was amazing. That was amazing. We're going to edit just your piece, Stephen, and get it out there because it just encapsulated everything. That was fantastic. Thank you. I now would like to introduce Elizabeth and Fernando Gomez, who are the co-founders of the Integrated Community Collaborative. And I really asked them to think about, so they're an organization that works with families who have a family member with a developmental disability. And they are, I will be totally transparent. I'm on their board. I think they're the most incredible organization. I love all the work that they do. And one of the great things that they do is they reach so deep into the communities to families that have access to nothing. And you see what it means. And so I've asked them to really talk about the communities, knowing that In many cases, it'll be the parents that are making these appointments for their adult children to get the vaccine. Fernando and Elizabeth.
Thank you, Judy. In following with your line of transparency, I guess I need to say then that I also said on the Disability Voices United Board of Directors as the vice president, and Elizabeth and I are co-founders. And happy to see that, Judy, that what we visioned Disability Voices United doing is actually doing it and uniting these voices. First off, I want to say thank you, Judy, for helping organize this, and our fellow speakers for what they're sharing, and every single comment I already have several responses to, because it's really the subject matter is not only time sensitive, but it really can at this point be a matter of life or death. So we appreciate this opportunity. The Integrated Community Collaborative is exactly as Judy says. We do the community outreach. We do it on a peer-to-peer basis. We are parents. And as parents and self-advocates, we try to unite our communities to come together and address these type of situations. So Elizabeth with me, I just want to say a couple of things real quick, and then Elizabeth will chime in on some of her perspectives. We have a 14-year-old son who's part of the regional center system. He has a diagnosis, and it's no surprise. And for the last 14 years, we've been advocating, and we'll do so for the next only God knows how many more years, because that is not going to change. The fact that our son has an intellectual or developmental disability is going to stay as part of what the reality is today. So for our elected officials, our governor, to come back and be surprised that this community exists and that it's vulnerable as it is, and they're waiting for additional data to prove what they already know and what we've known for all these years, to me, it's ridiculous. COVID-19 is not prejudice. It doesn't discriminate. It affects every single one of us. But the solution in trying to find the vaccine and a way to protect our community, I believe, is very biased and discriminatory. I think that not only from the governor himself, which I believe, as Andy and Stephen have stated that we need to reach out, but all his advisors, where are the Latino elected officials? Latinos represent 42% of the 360,000 individuals served by the regional center system. I'm not going to throw statistics at you. I'm speaking as a dad, as a father of an individual who's part of this community, because we have enough of statistics, right? We already know what those numbers are. But what we don't look at, and that is the cultural, the dynamics that evolve day to day. So yes, it's extremely important to address how is it that we're going to get the COVID-19. It's just as important to figure out the process and what immediately follows after that. Nikki, you nailed it when you said, what about people who don't have the cars, who don't have access? There are a lot of people who don't trust the system for many reasons. And those are all barriers that we try to identify and work through to help make the connector points. But there's still a reality. More so today, they're amplified. A year into this whole COVID-19 pandemic, we still have more questions than answers. And it seems like it's probably going to get worse before it gets any better. So my perspective, and I apologize to the interpreter because I do get somewhat animated and I'm probably speaking way too fast. So I'll try to slow down a little bit because I know they're translating, because there are a lot of our families. And we focus a lot on the Latino community, but it's about everybody. It's not just one group, but as the Latinos, we know that we're at the higher incident rate. And let me talk about a dynamic within the dynamics. So here we are looking for a solution, and how is it that we as a community can have access for our family members or the individuals who are self-advocates to get the vaccine. But as I mentioned a minute ago, 42% of this community is the Latino. And we look at the dynamics within the Latino household, and we know that it's multiple generational, that it tends to be a larger setting, more people in a house. And many of us are workers. We still are out in the community. We have to, as essential workers, need to be more involved. then that even creates the risk to bring something to, or to bring the virus into our home, where we have the limited resources, where we have the higher exposure rates. So the statistics already show that. I don't believe it's about data anymore. It's about implementation. It's about communication, and it's about engagement. And like I said a minute ago, where are our leaders? Where are the Latinos? Where are the African? Where are the Asian voices? So that it rounds off the full community and represents how diverse that we are, not only in our needs, but also in our culture. So I'll let Elizabeth also chime in on some of her points as well.
Hi, thank you. Yes, so I also want to thank everyone that's here this afternoon and sharing your thoughts and everything, because I agree with everything that's been said. And it's not specific to the Latino community, but those are the families that we work with. And so what I came here to share with you is how is it really affecting this group of families that we work with. Well, I want to tell you that, you know, the transportation issue, the technology issue, the lack of information, the fear of the system, or the fear of the science, fear of many other things, you know, it's really a reality for the Latino community. But one of the things that affects us the most, I think, is the fact that even as the community tries to follow the process, you know, make the phone calls, try to navigate the best that they can, they still are finding it very, very difficult to get through. They're not given the actual appointments. They're telling them that there's no availability. Some of the families actually are driving very, very far away, finding a way for the transportation, driving far away. When they get to the location, they're turned around and they're told that they can't give them the vaccine. Sometimes we've actually said, you know, here, you know, you have to reach out to your regional center, get the letters that they're providing, download the letter from DDS if possible. Here's the letter. And then we're finding that that's still not working for them. Even with that, they're being turned around. When it comes to that, I think it also speaks to a dynamic that affects us a lot. And that is that sometimes with the lack of, you know, the language barriers, or even sometimes the same community of people who are supposed to be supporting are sometimes the barriers for the families. So I want to say that I agree also with what Lourdes was just saying, just you know, when the webinar started, and the fact that sometimes what we're seeing is that families are going to locations and some of them are being turned around, but some other families are getting through just because they stayed the 8 hours and they waited. So we're hearing a lot of stories like that. Another thing that I think that is very heartbreaking for me is to see the community, after you get past the fear and decide that this is the right thing to do, and you try to make the appointments, not having someone to lead them and walk them through the proper process and be able to be successful in going to these locations is actually a big problem right now. I know it's affecting a lot of people, but it's magnified with some of the Latinos. So I don't know if we want to, Judy, open it to questions, or because I know that there's a lot of people here that are experiencing a lot of these things that
yeah, absolutely. Thank you, Fernando and Elizabeth. Thank you, Nikki and Stephen. I know that there were some people with their hands raised who I didn't get to earlier, and I'm not sure if your questions were for Andy and Imparato earlier, but I wanted to just take a moment, even though we're here, the purpose of this town hall is to demand that people with disabilities who are at high risk get access to the vaccine. I did want to spend a few minutes, because I'm just seeing so much activity in the chat, talking about the fact that family members and caregivers who are walking in with this letter from DDS, who are eligible to get the vaccine, are still being turned away. So I'm wondering if someone, I know that there's a bunch of people whose hands are already raised, so I'm not really sure which ones of you are having those issues, but if you could let me, I'm trying to think. So maybe we'll start with Tim Cabral and see if that's an issue you've been having. I know Cindy Lou, you were writing in the chat that you were having that issue. So if anybody, just write in your chat your name and I'll call on you. But first we'll call on Tim Cabral. You can go ahead and ask your question, and then I'll look to the chat to see if anybody wants to talk about that.
Okay, my name's Tim Cabral. I am a consumer from Valley Mountain Regional Center here in Stockton who has a mental delay. I do have a disability. My question is for, I'm trying to remember which person it was, but it's a question for everybody. How is it possible to know exactly where my wife and I stand? I'm 45, she's 55, and we want to know where do we stand based on
the virus shot,
on the virus vaccine for us?
So that's a great question, Tim. So right now, people who are under the age of 65 are, unless you're a healthcare worker, you are not eligible to get the vaccine yet. So we're here to advocate so that both of you can get on that list sooner than when your age comes up.
Yeah.
And I was also going to let you guys know really quick. My wife and I are also involved with an advocacy group. It's called People First, and we before all this pandemic happened, we went to the state capitol and actually did speak on behalf of all people with disabilities.
Yep.
And I also wanted to let Fernando and his wife Elizabeth know, that takes a lot of hard work for you guys to be able to reach out to the Latino families and the people that are uneligible, have a hard time of connecting with people for support.
Yes,
and we want to thank all you guys.
Thank you, Tim. Really appreciate it. Great to see you. So I just unmuted Cindy Lou because I know you put in the chat. I just want to touch on this issue and then go to another issue about people being turned away who have appropriate letters. Cindy, are you able to speak right now?
Yeah, sure. Thank you first, everyone on the call and the advocacy, and Judy to you and your leaders for organizing this. It's been willy-nilly in my county. I live in Ventura County. My husband, I actually qualified under IHSS and my husband did not. So he took the DDS letter and out of sight, he got it, didn't even get checked. Just going to put it out there because I think there might be some bias at the site, but he happens to be a white male. I'm thinking the next day, I don't need my IHSS pay stub. So I went to a different site in our county and they were like, no, they wouldn't even look at the letter. And of course I raised the stink and I wrote a letter to our local newspaper, rattling some cages. Ultimately I got the vaccine because I had my IHS pay stub, but truly the reason they were denying me is what got me so pissed off. And there are many, many in my county who are now being denied based on the DDS letter. And those of us who, quote, slip through the cracks are concerned whether we'll get our second dose. So, our local regional center, we were hoping I don't know the way it networks, but they got a clarifying letter saying that Ventura County is not qualified right now, only paid healthcare workers. So it's site by site, county by county. Our county health officials and county supervisors have not commented on this publicly.
Okay. Thank you so much.
I did send you an email. I appreciate your outreach on that. I'm happy to share my story and help gather others. I know at least 10.
Great. If there's anybody with their hand up who has a similar story, you can just put in the chat. I see Mary Platt has private messaged me. I'm not sure if you're wanting to talk about it. They're happy to have you tell your story. You are welcome to do that, but I don't see you raising your hand, Mary, so I'm not sure if you want to speak about it. Okay, so we're going to move on now to Jane. Jane Kiviat. I'm asking you to unmute. Jane, did you have a question or a comment? I'm not seeing anything happening. So, okay, so we're going to move on now to Adam Wang. Adam, are you there? Uh-oh.
He's coming.
He's coming. Adam's
What
coming.
are you talking about? What? Oh, okay. But I don't know my question. Hold on.
All right, Adam, we got to keep moving because we're live on Facebook. So I'm going to move to Connie Boyer. Go ahead, Connie.
Hi, can you hear me?
Yes, I sure can.
Okay, thank you, Judy, and everyone for putting this on. I did get on a little late, so I hope my question is not redundant, but I, as a public health nurse, a former public health nurse, I understand where they're coming from in terms of the numbers. I don't agree with this, but they're just trying to get their numbers up in terms of prioritizing who gets the vaccine. So my comment suggestion would be, because I've been writing into everyone I know, would be to start contacting our local legislators. And I guess my question is, do you think that's a good idea? I mean, our state legislators, to tell them the problems briefly. You could speak with their health aide, tell them the problems, why people are going to die and or end up in the hospital because we're missing a whole huge population of high risk by making them wait so long. So I guess my question is, do you think that's a good idea to start phoning into our legislators and telling them that this is really not okay, the way they're just prioritizing by age only? That's my question, my first one.
Yeah, so Connie, I think that's a great question, and I definitely think you should do that. I know I've reached out to my local state legislators and told them that they should put pressure on the governor. Remember that ultimately the buck stops with the governor here, which is why you heard Andy and you heard Stephen say, and you heard Nikki, all of us saying, reach out to the governor. He makes the decisions here. And one of the things they're talking about, which you had mentioned, is the, this balance between speed and equity, where they're trying to move forward with as fast as they can to get the vaccine out, and they're seeing equity in some way as a barrier to speed. So right there, I have really serious concerns. But then as an observer, I don't think they're doing either speed or equity very well, because we know how slow this is going out. So certainly, since equity hasn't been done, I don't see equity as being a barrier at all, since speed is most definitely not happening. So,
and my other comment has to do with equity and the regional centers. I wrote to my local regional center recently and said, do you have the ability to notify everyone? Let's assume that they do give regional center clients, more priority. Do they have the ability to notify everybody, and how fast? So I'm curious about that, if that's actually in their capacity. The other comment I want to make is, if they insist on staying with just age only, the next tier has to do with people with who are incarcerated or homeless. If they're in a congregate setting, they are given priority. My question is are the regional centers, are they going to even give us any hassle for people who are in, say, small, maybe board and care, ICF, group homes, and supported living? The reason I mentioned supported living is I spoke with a physician recently who is very familiar with autism. She's a pediatrician, and she said, and I agree with her, a supported living setting should be considered a congregate setting, because you have many caregivers coming in who are seeing those patients or those people in the setting, but they're also going to other settings. So in fact, that is like a congregate. The risk is the same. So I'm not sure if we can do anything about that. I know I wrote into Aaron about it, who sits on the committee, but again, I think it's a matter of education with these people and also putting pressure on the legislators. So I'm curious, do we have congregate settings defined clearly?
So Stephen, I want you to join in to me too on this as well, Stephen, Simon, but we are, I can tell you that that congregate settings are not equated with people who live alone and have supportive staff. People who live in supported living are not eligible for the vaccine at this time unless they are over 65. And that is a point of advocacy. Stephen, do you want to comment on any of this?
Right, I'd like to comment on both pieces of the question. So yes, I agree with your answer there. The majority of our community is left out in the congregate setting definition. That said, we still need to really define congregate setting well and make sure people with disabilities in congregate settings are served. And those go down to very small, unit, 6-person congregate living. So both need to get done. But then I want to circle back to her first point around the broader advocacy. Again, like you said, governor first, governor first, governor first. Don't call other electeds instead of the governor. However, if you have the capacity and time to do it, call the governor first, talk to your state elected officials, talk to your city and county ones. Again, the county is going to be making some implementation decisions post the state decision that are vital. And like I think Elizabeth and Fernando were saying, if you're fighting in particular for the Latino community, call Latino electeds. You're African American, call African American elected. Get to electeds in any constituency demographic you can that will support you, that and get them to be putting pressure on the government, and then secondarily on the county supervisors in your county to make sure people with disabilities are included. The bigger we can make this push, the better, and that's unquestionable.
And Stephen, I'm just going to make a comment to you and to all of our presenters that you do not need to raise your hand. You have the ability to unmute yourself at any time. And if you'd like to comment on any of the questions, please just chime in at any time, okay? And thank you for the person in the chat who told me that Stephen had his hand raised. I appreciate that. I'm calling now on Christopher Bennett. Go ahead, Christopher. I asked you to unmute, so you should be able to unmute. There you are. You need to unmute, Christopher. There you go. There you go.
Hi. My name is Christopher Bennett, and I live in Napa County. I'm a grandson of a Latino and a great-grandson of a Latina. On my father's side of the family. And I graduated from policymaking from New York, California, and I have some experience in the field. It sounds like you need some legislation assistance, so I'm willing to be up for the chance to help you. I volunteered for the state senator a while back, and phone calls to Sacramento back and forth. But anyways, I have Down syndrome, and I'm 38 in Napa County, and I checked the list on my learning disability, and I didn't know mine was on the list of high risks. And I work in hotels, in the hospitality field, in Napa County. And I was just laid off due to the pandemic and trying to get back to work. In the meantime, I'm being my fiance's advocate at the same time too, same thing for her. Except she kind of works within the wineries, but at the regional center. So,
Wine Bev Services.
And it's called Wine Bev Services of the UCP of the North Bay with North Bay Regional Center. In the house phone, sorry about that.
It's mom.
So Christopher, you sound like you will be an incredible advocate. I would love to connect with you outside of this meeting because I would love to get you to speak to some of the media. Would you be willing to do that?
Would you like me to put my contact on the chat?
That would be so great, and I'm going to contact you probably later today. All right.
Great.
Thank
By
you.
the way, I'm friends with the state senator, Bill Dodd. Because him and I have been friends since I first volunteered in between jobs one year.
That's so great. I am excited to work with you. That is so
Awesome.
great. Thanks, Christopher. All right, we're going to just take one more question right now, and then we're going to move on to the last section. And that question is from Sean Shrum. Sean, I've asked you to unmute. Okay, good. Oh, sorry, I might have accidentally muted you, accidentally after you unmute. There you go, Sean, go ahead.
How's it now? How's it now?
You got it, I hear you.
I found out from an advocate, Jill Jacobs, who just moved to Virginia, that the vaccine websites have not been found to be compatible with screen readers. So those of us with a vision impairment or are blind, need some kind of accessibility there, are unable to access these. And this is a problem that needs to be addressed from the top down. She did mention that for she and her allies, going county by county and having to explain things has just been exhausting. And so that is another area that we need to that we need to work on. I'm a guide for blind athletes. I can use social media, within the groups that I'm already in, and give them some specific action to take from within this meeting. But California leads the nation, and we're a big population. What are we, about 2 million people identifying as living with a disability in the state, something like that?
Oh, way more than that. Way more than that.
Thank you. Yeah, big voting bloc, a large economical machine, right? So if we can sort of effort this nationwide, then any instruction you have on this, I'll take and do what I can.
Yeah, I don't know, Stephen, if you want to chime in on this too, but that is accessibility for people who are blind or low vision is a critical piece of this. If, in fact, the state of California has a requirement that all government websites must be accessible. So that's pretty amazing to me that they are not even meeting those basic standards. So I am personally going to take this up at Disability Voices United, because that is one of our passions. We do a lot of work in that area, and we're going to have one of our staff actually do an examination of various websites to see if they are accessible or not. But this is where the Americans with Disabilities Act kind of requires this. So we need to, Andy Imparato from Disability Rights California has had to get off, but this is an easily a legal issue that we should really get their attention for. I'm making a note on this, and I'm going to make sure that I follow up with DRC on that.
And the quickest footnote I'd add on that, Judy, is yes, look, a standard letter sent to both the state, and I would again go to every single county that's got a health department to just remind them of that. I don't want it to be it's easy for me as city government to say this, but I don't want it to be a lawsuit threat. I want it to be, look, we need to fix this right now. And as they all need to be assessed and user tested. And then two, the 508 and ADA compliance, as they're fixing that, if they need to always have a phone or other opportunity for people to get help registering for vaccines. That needs to get in place right now, and they need to plan for that. So there should always be an opportunity, and that works for cognitive disabilities as well. I mean, it's the same kind of issue. If someone cannot navigate the website for whatever reason, they need to have an alternative to get to a person to help register and get the information about vaccines. Absolute requirement.
Thank you. So there's another quick question from, actually, you know what I'm going to do, Rick, is I'm going to hold off. You just raised your hand. I'm going to hold off on you and move to the next section because I want to make sure we have time, because I think there's going to be a lot of questions on that as well. Our final speaker today is Dr. Laveeza Bhatti. Dr. Bhatti is infectious disease specialist, which is kind of handy nowadays to have around. And but she amazingly is not only an infectious disease specialist, but specializes in providing care for people with disabilities. And she does that both at the Achievable Clinic, which is an incredible clinic for people with developmental disabilities in West Los Angeles, and is a consulting physician at Westside Regional Center. So thank you for joining us, Laveeza. And I really asked you to talk a bit about, we got so many questions last week, and I'm seeing some of it in the chat today. It's like, which vaccine should we pick? And will people with disabilities have a higher risk of side effects? And, we're hearing that it changes your personality. It's like, we got to dispel some of the myths. So go ahead.
All right, it's a pleasure to be here. So the way I structured it is basically based on the kind of questions that I have gotten from patients and from families. So I'm going to start a little bit with just the basic facts, then what kind of vaccines are available, what is RNA technology, because it has been an incredible number of questions that I've gotten on that. I did make some notes on that, and all the questions that the myths that have been out there are mind-blowing. So I wanted to address some of those. Then I'm going to touch on the side effects, the efficacy, and the contraindications. So just so that everybody knows a lot about these vaccines and are able to make a very good decision on that. So the first thing I wanted to talk, just a couple of things about the numbers. So we have the reported deaths are about 2.28 million across the world, and more than 100 million people have been infected. So this is a very, very significant illness. And we're talking about reported numbers, and we know that they are way, way more than what we actually have reports of. The other thing, the important point to understand is that a lot of people have been saying to me that all viruses kind of die out and this is going to be okay. But one thing that one needs to understand is that no viral disease has actually ever been fully controlled without a vaccine. So we have to look back at all our childhood vaccines, at hepatitis A, hepatitis B, so many viral diseases, Ebola, rabies, all of these actually do need vaccines. So just the understanding of the fact that you do need vaccines to control a disease. And then the other thing that a lot of people say is herd immunity is going to get us to be fine. That's not going to work, because for herd immunity to even happen, you need to have 1.2 million people dead. And that is absolutely unacceptable. So how do we get to herd immunity? We get to herd immunity by vaccinations. Now, what are the main kind of vaccines? So the reason I want to address that a little bit is because a lot of people have said that, why do we not use the older technologies? And this is a very new technology. So RNA, I wanted to make sure that people understand it's not really a new technology. There has been work that has been going on this for the last 25 years. So this is an old technology in that way, that the studies and the way that scientists have looked at it has been a long period of time. What are the main kind of vaccines? We can have a killed virus. We can have a portion of the virus that is inserted into a live vector. And that is where the Johnson & Johnson, AstraZeneca, Sputnik, all of these are the ones that are using live vectors. So what those are weak viruses that are not able to cause a disease, and you insert a particular gene into that virus so that it can now cause, train the body to produce immunity against a certain thing. RNA is a newer technology. The RNA is a very delicate, or what should I say, delicate thing, so that you have to coat it in a vehicle that can actually enter the cells. So some of the side effects, or some of the anaphylactic reactions that have happened, are thought to be related to the polyethylene glycol that is in the coating of the vaccine. So when we look at the vaccines that are available in the US, we have the Pfizer vaccine and we have the Moderna. And a lot of people have asked this question as to which one is better, which one should we get? They are both very equivalent. They both induce excellent efficacy, 95% efficacy in protecting against the disease. Remember that our flu vaccines, we accept anything between 29 to 60% efficacy, and that is what those vaccines actually protect us against. one thing I want to also say that a lot of patients, when I have spoken to them prior about getting flu vaccines, they would say that I'm not going to get the vaccine because I'm still going to get the flu. And the important point to understand is that I've always told them is that the reason that you're getting a vaccine is to protect against severe disease. The fact that you're not going to land up in an ICU and be intubated, that is what the vaccine is mainly going to do for you in a flu vaccine setting, which is the efficacy of these vaccines is way beyond what we have for the flu vaccine. So that's an important thing to remember. I made some points on the myth question, so I wanted to address those. That this vaccine is going to change your genetic material. Your genetic material is contained in the nucleus of a cell. The RNA viruses, the RNA vaccines do not enter the nucleus of the cell. So you have to remember that they're not entering into the genetic control center of your body. So that's an important point. And you wouldn't believe how much of this point has been raised. And I want people to clearly understand that the RNA vaccine is not entering into the nucleus of a cell. So it's not changing anybody's genetics. Also that it's going to cause an infection. It cannot cause an infection because it's not the organism. It is a portion of the virus, just the portion that we need to induce immunity to, that is going into the body. Also that you can get a positive response on a test. You cannot get a positive response on a viral infection on this, because the virus, when we do the test, we're actually looking for live virus and multiplication of the virus. What the test would be positive would be for the antibody, but not for the actual infection. So that's the reason I brought this up, is that people that are traveling, oh, I'm not going to be able to travel if I get the vaccine. I'm not going to be able to do this because I'll be tested and the test will come back positive. So people need to understand that getting the vaccine is not going to change the PCR-based tests that are used to look for active infection. And also a lot of questions about that this was hurried through, so we don't have enough evidence. There were more than 30,000 people. That's a huge number of people in a clinical trial. And the companies waited for a period of time to make sure that they didn't get anything in their surveillance data to make sure before they actually went ahead and applied for FDA evaluation and FDA approval and all of that. And I liked something that Anthony Fauci had said, and I quote, he said, we don't know everything, but we know enough. So that's a really important thing for people to know, that we know enough about the safety. Nothing is 100% safe. People can go, you can get a penicillin, which 1 million people take every day all around the world, and you could have an anaphylactic reaction and you could end up dead with penicillin, with all the number of people. And I was just looking at the numbers today, and everything keeps changing continuously. More than 30 million people have gotten the vaccine, and there have been no major adverse events that have raised a very significant red flag. So that's an important thing to keep in mind, that this is a safe vehicle as far as we know to this point. What are the side effects that you can have? Most of the people talk about soreness in the arm, just fatigue, flu-like symptoms. And that's the main thing. The major side effect that everyone is concerned about is the anaphylactic reactions. Most happen within the first 15 minutes of receiving the vaccine. And they are all the places where you are going to get the vaccine are actually ready to basically treat it, and all it needs is management, and usually people are fine with it. Let's see, in terms of contraindications. So if you've had an anaphylactic reaction to the first vaccine, it is contraindicated to get the second dose. That's one thing. Or if you have a history of anaphylactic reaction to any of the components that go into the virus and the production of the virus, why take it? I think I can't explain how important it is to take it, because those of us who have seen what happens when you get the virus, the reason I wanted to really stress on this is because a lot of people are saying that, oh, I will get the virus and it's like flu and I'll be fine. You may or you may not. Sometimes people who get this infection are getting these long-term effects that are really, really significant. We have no way of telling who will and who will not be a long-term person suffering from the side effects of the virus, or the long-term effects. And there is something that is coming into our terminology where we talk about somebody becoming a pulmonary cripple. What that means is that you take one morsel of food and you get short of breath before you can take the next morsel of food. Overwhelming fatigue that, one of my patients can't get up, and she's 52 years old. And it's difficult for her to get up and she was perfectly healthy, one of these people that were running marathons before she got the coronavirus. And it's difficult for her to even stand up and walk 10 steps. And she gets short of breath in those 10 steps that she takes. So it's really important when you have something that can possibly control the spread, then that's really important for both the spread and the consequences of the disease. Remember that if you have the vaccine, it's less likely that you're going to be infected with the virus. We don't know 100% as after if you get the vaccine. Remember, the efficacy is 95%, so 5%. You could get the infection, but if you do, could you transmit it to another person? But all the intensity of disease depends upon how much virus you have in the body that's causing the disease. So if you have had the vaccine, you are going, even if you get infected, you would get infected with a very low response to the virus. And most of the people we know from all of these vaccines, the RNA vaccines, the vector-based vaccines, that they prevent severe illness. And that is what you want to prevent. I think I touched on most of the things. Judy, if you have any other question, I can address that.
Oh, there's a lot of questions in the chat. So I know there's a bunch of people who also have their hands up. I'm not sure if their questions are for you or for previous speakers. I'm just going through the chat because I've seen that there's been a bunch of questions. What do you know about the new Johnson & Johnson vaccine or the AstraZeneca vaccine?
So both of those are what's called vector-based vaccines. So they're using an adenovirus. It's basically a virus that is not able to cause disease in humans, or basically not cause disease in us. And what they do is that they take a certain portion of the genetic material of the virus and they put in the spike protein so that it goes, when you inject it, it's a live organism. It's a single dose, which is a really good thing. It goes into the body and it induces an immune response. So the ultimate purpose of all vaccines is to induce an immune response against the spike protein. The reason that is important is because that's the portion of the virus, the coronavirus, that it uses to enter, and it's the most prominent part that you can induce an immune response to, so you prevent it from entering and replicating. Now, I just wanted to add another thing because there was a report on the Sputnik vaccine, which is the Russian-based vaccine. They are using 2 shots and they are using 2 different types of adenoviruses, just to make sure that if you have some previous history of exposure to the first adenovirus, you would be able to mount an immune response to the second one. That actually shows a 91% efficacy, which is higher than what has been shown in AstraZeneca and Johnson & Johnson. But the important thing really is that we know that these vaccines are preventing severe illnesses, even if their efficacy is less than the RNA vaccines.
Thank you. Somebody asked in the chat, I mean, this is just a question because I've heard this honestly from a number of people that they spoke to their doctor and their doctor insisted you should absolutely get Pfizer or you should absolutely get Moderna. And these are like their primary care physicians. I mean, should people be listening to that kind of advice?
Not at all. I shouldn't say it like that, but the ones that we have available in the US is the Pfizer and the Moderna, and they are both excellent. They are both very, very similar. Get whatever you can get at this point.
Yeah, I agree. I got the Pfizer. My son's staff member got the Moderna. We both have both vaccines, and neither one of us had side effects, except for a little sore arm. So I'm a very big fan of getting vaccinated, but obviously these are personal choices. I'm gonna go to Rick Watts right now. Rick, did you have a question? You could ask a question to any of our speakers, Fernando, Elizabeth, Stephen, Nikki, Laveeza.
Hi, can you hear me?
I sure can.
Thank you.
Oops, I now lost. Rick, you're going in and out a little bit. Right, yeah.
Thank you. Yeah, just a couple of quick things on the.
Oh, Rick, we're losing you.
Can you hear? Okay,
Can you
hear
call
me?
in? And I'll call on you when you come back in.
Can you hear me now?
Yeah, I can.
Can you hear me?
Yes, I can. Can you hear us?
Hi.
All right.
Okay.
Try calling back in.
Yeah.
Okay. All right. Let's
I'll
go
try
to
that.
Mitchell. I feel like one of those radio hosts.
I
Oh,
can. Can you hear me?
Yes, now I can. Go ahead.
Okay.
Oh. Now I lost you again, Rick. Oh, you have poor signal. Okay, we'll keep trying you, okay?
There we go.
Now you're,
I think we get
sorry,
better.
Rick. It's not working. Chris, Mitchell, go ahead.
Okay. I'll try back.
Okay, thanks. Chris Mitchell.
Hello, this is Chris, the fellow California. I'm urging everyone across my home state of California to do their best and remain safe from any effect of COVID-19, even as they wait for vaccination. I wish everybody all the best as they wait for vaccination to come, and especially in the disability community within my home state of California. I wonder what the future will be like for anyone in the disability community, especially in California, my home state.
Thank you, Chris. That was really well said. So appreciate you being on. Connie Boyer, go ahead. Hold on, I have to get you to unmute. Oh, my thing keeps going on. Okay, there you go. Go ahead, Connie. Connie, where are you?
Can you hear me now?
Yes, now I can hear you.
Okay, yes. I'd like to address the issue of vaccine hesitancy. Speaking as a parent of an adult whose one of the caregivers got COVID, and it was a very scary situation. This was before the vaccines. How would you handle? Some of my son's caregivers are very willing to get it. Others are not. I've done a lot of education with them, in terms of, well, if you get COVID, that's, not a good thing. I mean, yes, you might have mild symptoms, but you can have very serious symptoms. My question has to do with how do you address the question when they say, well, we don't like how fast the vaccine was rolled out. We don't trust it. We want to wait a year. That puts my son and others at risk. It's very frustrating. I mean, I understand that they're nervous because this is a new technology, but how would you address that? So, and do you think at some point, and I hope we don't have to go there, but you know, other vaccines are mandated. Our children have to be vaccinated before they enter school. You have to have a tuberculosis clearance before you may work somewhere. So how do you deal with the caregivers who don't want to do this?
Hey,
Because
Judy, can I answer that?
Sure.
Can I address that? This is Nikki.
Go ahead, Nikki.
So, I mean, I may say something that's really controversial, but I'm going to say it anyway. I have 6 caregivers that come in on a regular basis, and I have made it pretty clear to all of them that if they are not willing to get vaccinated, then they are going to have to find other employment. I've been really clear with them because, you know, I have a fused neck, so if I were to get COVID and go into the hospital and needed to be intubated, it's really, really difficult. I'm extremely difficult to be intubated, and so they're really putting my life in danger. And the discussion that I've had with them is that I've explained my own situation to them and I'm like, look, I really care about you. And I know that you care about me. And if we're going to care about each other, that means we need to take care of each other. And for you to take care of me means that you need to get vaccinated, and I will get vaccinated so that I can take care of you. So I put it in terms like that to them. And if they're not willing to get vaccinated, then I'm like, you know what, then I'm sorry, you're just not going to be able to work for me. It's just because you're not only, because another thing is that all of my attendants work for other people. So they're not only putting me at risk, they're also putting all the other people that they work for at risk and those people's family members at risk. So it's not just about them. And I really talk to them about that it's not just about them.
Thank you. We're the same. We feel the same way in our household where we mandated all of my son's staff to get vaccinated.
Judy,
you want to comment on that?
Yeah, Fernando and Elizabeth.
Fernando, go ahead, Fernando.
Yeah, you know, and just kind of expand a little bit on what Nikki was saying and a little bit to what Dr. Bhatti was saying as well. You know, our son has Down syndrome, but we always say we don't have a son with Down syndrome. We're a family with Down syndrome because we're all impacted one way or the other, and we have to take care of each other, and we have to look out for each other as that circle of trust, a circle of support. And you know, when it comes to an exposure like a pandemic like this, and what Dr. Bhatti was saying, and appreciate you talking about the myths, you know, especially in our community, you know, Elizabeth and I were fortunate enough to get the vaccine, and we had a lot of people looking at us, waiting to see at what point were we going to turn into zombies. And to this point, we haven't. But I kind of joke a little bit, but in reality, you know, we know the stress levels. We know, I mean, without a pandemic, our lives are already very stressful and challenging in many ways. But now with this whole situation upon us and hearing even Nikki having to share that she has to put these conditions, I know exactly how high those stress levels are and the mental health issues that we're all being challenged with. So I just wanted to kind of expand a little bit on that and say, I think we're all in this together. And if we can keep united and these voices together, that we can help find the solutions, the faster, the better.
Thank you. Since I have the microphone, I just want to thank you for the discussing about the myth, Dr. Bhatti, because I have to tell you that I was actually not going to go into that, but I'm so glad that you did, because one of the areas that has affected a lot our community has been a lot about this myth and hearing all the different things that are out there. So understanding exactly the ingredients and why it's safe, I think is extremely important. And that message we have to continue to pass to the community. Thank you.
Follow the science.
I also wanted to stress the fact that a lot of people, when they say this is an absolutely new technology, is one of the points that I had made was that this aspect has been studied for 25 years. And also to know that there was very rigorous trials of a lot of people. These are huge trials. I mean, generally you do a clinical trial, you have, maybe 1,000 people, 1,500 people. I do clinical trials, so I'm aware of what the usual numbers are, but a clinical trial done with the number of people that were tested is really important. And there's a lot to be said for the fact that this has been something that has been so talked about. We didn't really question to this extent Gardasil when it came out. It was a new vaccine. Shingrix came out, it was a new vaccine. Prevnar came out, it's a new. Every technology is better than the previous technology, but the level of scrutiny that we are giving to this technology, we did not give to the other ones that we go and happily take. The vaccines that have, in a way, are quote unquote newer vaccines.
Thank you. I'm going to go to Stella Williams.
There we go. Thank you very much. This question is for the doctor. If you have a very high, low risk, not low risk, high risk, low immunity system, and you decide that you want to go to get your vaccine, should you be careful where you go? Because if you did have a reaction, where you would want to be somewhere where people can attend to you. So you don't want to just go through a drive-through situation. Should I be careful about where I go?
So the people who have significant comorbidities, I always advise them that they need to talk to their personal physician, because that person knows you well and will tell you where to go. But if you are concerned, then yes, generally the facilities, as far as I am aware of one of my colleagues is working at Pomona, which is vaccinating a lot of people in a drive-through, but she is there on call for the whole day. So in case, and then also but for somebody with significant issues, instead of a 15-minute, evaluating the person for 15 minutes, in our own practice, we would keep.
Thank you very much. I appreciate that.
I think Laveeza froze on us.
It did a little.
Whoever to get vaccinated will have somebody, but I think that it's best to go to a place where there is a physician that is available.
And don't drive yourself, right? Because I'm a driver in the house, even though I'm in a wheelchair. But don't drive yourself, right?
Ideally, no.
Okay.
It's good to get a driver, but not an Uber, a driver from your own home.
Yes. Okay. Thank you.
I have to say that when I got my 2 vaccines, there were doctors there during the waiting period. So, I think that there is definitely some care, but I think if you have had an allergic reaction to any vaccine before, or if you have really significant underlying health conditions, it really is worth going to a health center or talking to your doctor about the best place to get it.
Thank you.
Absolutely.
Okay, how about Yola? Yola D, do you want to ask a question? Oh, you were muted? You were still muted.
Okay.
You have to unmute. There you go.
Can you hear me?
I sure can. Go ahead.
Great. So first of all, this is for you, Judy, and for Stephen. Is he still with us?
I believe he is.
So my big question is, have you contacted the media other than Facebook and whatever? Because I took the liberty and did contact someone about this, and I have multiple disabilities, by the way, and I'm a senior plus a senior. So, but I'm outraged that the governor has put the younger set, if you will, of those with disabilities in this state, out in the blue somewhere, that he has forgotten this important minority. And that would be my headline. Disabled persons in the state of California are a forgotten minority. So I'd like to urge you to roll out the talk line and the helpline to every person that was on this Zoom feed and Facebook feed today, and to urge them to write, call, email, whatever, the governor of the state of California and the health officials. And I urge you with great passion and sincerity from the bottom of my heart. I've been talking, I'm in West Hollywood in District 3, Supervisors District 3 with Supervisor Kuehl. And I think they don't have the ultimate say. I think it comes from the governor. And I'd like to ask your help. You mentioned it today about filling out the forms. Those forms that are online are very challenging. And it seems to me that they've forgotten about the Americans with Disabilities Act. There is no accommodation, no access given to persons with disabilities. It makes it very difficult, not only for those individuals, but their families, healthcare providers, assistants, in-home services, individuals, etc. And I think we need to do something immediately within the next 24 hours to speak.
So Stephen, what do you say to that?
Yes, yes, and yes. So again, number one, voice to the governor, voice to the governor, voice to the governor. I still, again, support talking to other electeds. Everyone on this call, you live somewhere in California, talk to your local media. Let them know this is something that matters to you, to your family, to your community, to your neighborhood. And I think if we did that en masse. Now, that said, I think as Andy pointed out earlier in this meeting, there's been some wonderful press very recently, not nearly enough, but we're finally getting noticed in this issue. So Yola, thank you, because actually she sent me on Facebook a good connection to media. We'll definitely look into that. But please, folks, call your local media and let them know your personal story, your family story, because it really does make a difference. And I think the general public would support our push to make sure people with disabilities had access to vaccines as a top priority if they knew this was the situation.
Thank you, Stephen. There's a person named Yo Domino Mi IET. That's what it says in the name. Go ahead and unmute.
Hi, good afternoon. Judy, this is Maria Ruiz Marrof. Yeah, how's everything?
Okay.
Yeah, thank you so much for this. This is a great opportunity. One thing that is happening, and I am basically in a lot of contact with families, you know what I mean? Between the PC plans and the self-determination and the EIP process. And there is two things that are happening. For what they tell me, and I think that probably Fernando and Elizabeth are maybe experiencing the same thing. A lot of the providers, of the people that are going to these families' homes to provide ABA or to provide respite, they are not vaccinated. Some of the families, at least 4 of the families that are not contract the COVID-19 because of from these basically workers. There is no regulations. There is nothing, happening. Nothing that tracks if they has been vaccinated or not. Even if they have the little piece of paper, I want to let you know, and I'm sorry to bring this new, but that piece of paper is being basically photocopied because some of those pieces of paper, they don't have the name and the information of the person that was vaccinated. They said only that the person was vaccinated this day and everything was positive or negative, but they don't reflect the name. They don't have no documentation at all that reflect that a piece of paper belonged to that person. So how the state, how the leaders will actually manage that, because this is something that is a concern.
Yeah, and certainly that, so we are working on trying to provide that sort of help and assistance to the state to ensure that the people who will be eligible to get the vaccine are able to get the vaccine, and then the people who are not eligible are not able to sort of cut in line by doing something that requires them to tell a lie or be fraudulent. So that is definitely something we're working on. Fernando, Elizabeth, did you want to comment?
Yeah, I just wanted to expand on what Maria was saying. And Maria, good to hear from you. And thanks for bringing the subject up. You know, and a little bit to Nikki's point earlier about being cautious. Unfortunately, we recently experienced a situation where that actually happened to one of our integradoras. One of the support persons came in who had the virus, not aware of it, and ended up contaminating both of her and her grandchild. And it really is just a very scary situation. But one of the key dynamics, and as I was sharing earlier about, especially in the Latino households where we have our children mostly at home. So you're now having all these individuals come into your house, and you're just kind of at risk. You don't know because of things like what Maria was sharing. And there are things we can do. I mean, we can bring it in closer to a smaller circle. We can engage family members and that sort of stuff. But those are all of the elements that have to be addressed one by one, because, you know, unfortunately, even when we do get approved to get the COVID vaccine, hopefully like tomorrow, the problems don't stop there, because COVID-19 is not going to go away. The challenges continue. And these type of conversations definitely continue. And instead of having 200 people at this time of the day, we should literally have over 2,000.
Thank you. We're going to take our last question, everybody, because we are coming up against 5 o'clock, and I'm going to let that be Mulugeta, a representative from the Ethiopian community and a dear friend. Go ahead, Mulugeta. Go ahead and unmute yourself, Mulugeta. Can you do that? Are you hearing me, Mulugeta? Oh, yes. Go ahead.
Yes, a couple of questions. Thank you for giving me this opportunity. One of the questions is to Dr. Bhatti. A lot of our community members are staying home and they are trying to protect themselves, and they are not even sure whether they have to take the vaccination or not. And I'm trying to answer that questions. One of the questions they are asking is, what if we do not want to take that vaccination and try to protect ourselves? The second one is Fernando touched up about trust. Sometimes, you know, you don't trust the person who's administrating the vaccination. I came from a culture where if you don't give a shot, you're not a good doctor. You have to give a shot instead of tablets. So people are very, very rely on the person who's administrating this thing. And one of the participants was asking about, you know, small places like CVS, Walgreens, things like that, taking vaccination from that versus to really a good place. You know, is there any, and the type of, is it real? You know, I heard about a lot of stories back some years back around African American community, and you know, they have a concern. And how do we just get rid of that concern? So a trust issue, at the same time, the place. The third one is, do we have to take it, and can we just survive that? Thank you.
So the trust issue is actually really important, and the way to address it at this time is to speak to your own physician about your concerns so that they can address it. At this time, I totally get it, because patients are used to getting vaccines or blood draws at their clinic at a setting that they're comfortable with. But at this point, because of the way the vaccine is being distributed, clinics do not have the ability to vaccinate as such. So I think talking to a person, a caregiver, a physician, or a clinician that you trust, and getting their input on this is important. There is no possibility that somebody can go to a vaccination site and be given something that is not the right vaccine. So I think that is an issue of trust that really needs to be addressed, which are concerns with people that may not be totally trusting of the system. So that really does need to be addressed. There's many questions that you can answer for a person that asks those. The second question that you raised was whether people staying at home is adequate for them to be immune. That is not a good way to get immunity, because you have to basically stay in one room without even stepping out. A lot of infections are happening in grocery stores. You may be crossing somebody who's running. The infectivity of the virus has increased very significantly, especially with the virus that's coming from the UK. So that the idea that you can isolate yourself from the whole world and just sit in one room and be fine, the question really is for how long? This may go on for a fairly long period of time. And that is not a viable way to keep yourself safe. The safest way is to get the vaccine and be able to protect yourself through the immunity that the vaccine gives you.
Thank you so much. I want to thank everybody for, this is an incredible town hall. The last thing I'm going to say is to remind you, if you have not yet called the governor or emailed the governor or both, do it today. The point of this particular town hall is, we can talk about which vaccine or how we're going to stay safe, but none of that matters until we have access to the vaccine for people with disabilities. And so please call the governor, phone the governor. By registering for this town hall, we have your email address. We are going to get out right away the slides and contact information to get you to write the governor, because it's all about him right now, everybody. If you have time to do more than the governor, go ahead and send it to other people, but it is all about the governor right now. So I want to thank Andy Imparato, Nikki Brown Booker, Stephen David Simon, Elizabeth and Fernando Gomez, and Dr. Laveeza Bhatti for being here. I'm sorry I said those names incredibly fast. I'm looking at Josh, our amazing interpreter, trying to spell all those names. I'm so sorry. And I want to thank our interpreters, who are great, both our Spanish interpreters and our ASL interpreters. And as always, Ed Herzl, our program assistant, who's been coordinating everything and monitoring the chat and making sure everything was runs smoothly. Thank you all again. Please stay safe out there. Have a good weekend, and please call the governor. Take care, everyone.
Thank you,
Bye-bye.
Judy. Thank you.